This task covers opening and managing an airway. If a casualty is not breathing, determine the casualty is not breathing and take measures to restore respiration. For this task, you will need a nasopharyngeal airway. There are 3 ways to determine if the casualty is breathing. Use the head tilt and chin lift method to open an airway and listen and feel for breath. You can also watch for the rise and fall of the chest, or you can feel for breath on the back of the hand. The normal method of opening an airway is the head tilt and chin lift method. If the casualty is conscious, the head tilt and chin lift will keep the airway open and help the casualty breathe easier. Place one of your hands on the casualty's forehead and apply firm backward pressure with the palm of your hand to tilt the head back. Place the fingertips of your hand under the tip of the bony part of the casualty's lower jaw and bring the chin forward. We'll now demonstrate how to perform rescue breathing. In rescue breathing, you blow air into the casualty's lungs and then let the casualty expel the air. This approximates the body's natural breathing. First, perform the head tilt and chin lift. Gently pinch the casualty's nostrils closed. Administer a full breath mouth to mouth and observe the casualty's chest to make sure it rises. Open your mouth wide and take a deep breath. Place your mouth over the casualty's mouth. Make sure that your mouth forms a good seal so that the air will not escape when you blow into the casualty's mouth. Maintaining the head tilt and chin lift will keep the casualty's mouth open slightly. Blow a breath into the casualty's mouth. As you blow, observe the casualty's chest. Check the casualty's carotid pulse every 12 breaths or so, about every minute. Pulse beats indicate that the heart is still pumping blood. Observe the casualty as you check his pulse to see if he has begun breathing on his own. Inserting a nasopharyngeal airway. If the casualty is conscious or unconscious and breathing on his own, count the number of respirations for 15 seconds. If the casualty's respiratory rate is less than 2 breaths in 15 seconds, insert a nasopharyngeal airway and place the casualty in a recovery position. Also take this step if the casualty makes snoring or gurgling sounds. Do not use the nasopharyngeal airway if you have evaluated head or neck trauma or see clear fluid coming from the nose. How to insert a nasopharyngeal airway is as follows. Lubricate the tube with sterile lubricating jelly or water. Expose the opening of the casualty's nostril. The casualty's right nostril is normally used for the initial attempt. Expose the opening of the casualty's nostril and insert the tip of the airway tube into the nostril. Position the tube so that the bevel, the pointed end of the airway, faces toward the septum, the partition inside the nose that separates the nostrils. Insert the airway into the nostril and advance it until the flange rests against the nostril.